For my psychoactive drug, I chose heroin. Heroin is made from opium poppy plants, and the opium is removed from the pod of the poppy flower. Then it is refined into morphine, which is then refined into heroin. Heroin is also a central nervous system depressant because it slows down the brain's functioning and the nervous system, and it can affect breathing as well by slowing it down or even stopping it. Also, heroin can take a few different forms, such as a white or brown powder, which can be seen on the left and the right. And there is also black tar heroin, which you can see in the middle picture. There are a few different ways that people use heroin, such as snorting, which you can see on the left picture, that the man has a rolled up dollar bill that he is using to snort the powder. And on the right, you can see that some people smoke heroin. And on the bottom picture, it shows that people even inject the drug into their body, usually their veins, which I think is what a lot of people picture when they think of heroin. Finally, some people mix cocaine and heroin, which is called speedballing. Oftentimes, people start out using prescription drugs and then they switch to heroin. Prescription opioids are highly addictive as well as heroin, so when someone is out of these opioids, if they get addicted, then they may turn to heroin, which could give them a similar high feeling and is much cheaper to buy as a street drug. And just to present some insightful statistics, 4 to 6% of people who get addicted to prescription opioids switch to heroin, and 80% of heroin users, which is a very high percentage, originally misused prescription opioids. So a common example might be a soldier who gets injured in war and is put on morphine, a very powerful and addictive painkiller. They could easily get addicted and later possibly turn to heroin. One short-term effect of using heroin is euphoria, which is often a desired effect because it gives the individual a pleasurable rush feeling. Some other side effects include dry mouth, extreme itching, warm flushing of the skin, nausea and vomiting, heavy feeling in the arms and legs, clouded mental functioning, which shows that the brain is not working properly, going on the nod, which means going back and forth between being semi-conscious and conscious, large drop in body temperature, narrowing of the pupils, and loss of sex drive. Some undesirable long-term effects include insomnia, collapsed veins for people who inject heroin into the body, abscesses, which is swollen tissue filled with pus, damaged tissue in the nose for people who choose to snort the drug, chronic constipation, infection of the heart valves and lining, stomach cramping, liver and kidney disease, lung complications such as pneumonia, mental disorders, particularly depression and antisocial personality disorder, sexual dysfunction for men. Additives like sugar and starch in heroin clog blood vessels to the liver, kidney, lungs, or brain, which can cause permanent brain damage. Irregular menstrual cycles for women. HIV and hepatitis C from sharing needles. Fertility problems, poor nutrition, and reduced immunity. Heroin also causes lots of damage to the body. On the right, you can see that in just a few years, this woman looks drastically different because of her heroin use. So on the left, you can see a picture of different parts of the body. On the number 1 section, people take the heroin and they could also inject it into other parts of the body, but from there it goes into the bloodstream and the heart, number 2, pumps the heroin-filled blood throughout the body. It travels to the brain, number 3, which is where it changes to morphine and attaches to opioid receptors, creating the euphoria and relief from pain. Then, at the liver, number 4, heroin goes through first-pass metabolism, which diminishes the effects before it goes into the body's circulation. Finally, at number 5, the kidney, It processes the heroin, which is then eliminated through the urinary tract. Heroin is horrible for the brain, as you can see from the picture on the left. It drastically and negatively changes the brain. First off, the brain is filled with cells, particularly receptors, that can be affected by chemicals that we ingest, which change how the body functions. These receptors affect pain, pleasure, anxiety, depression, and stress in the body, as well as how we breathe, sleep, and our appetite. When heroin gets into the brain, it attaches to opioid receptors, creating the initial and powerful high. Then, heroin changes into morphine and 6-monoacetyl morphine, which stays in the brain longer, keeping the person at a milder high for many hours. The reason heroin causes pleasure is because it overloads the receptors, leading to an immense amount of happiness and diminished anxiety and depression. Also, it blocks any messages about pain that come through the spine. While it causes pleasure, it still overwhelms the brain and hinders it from functioning effectively. When someone overdoses, it can also negatively affect the brain. First of all, an overdose occurs when an individual takes so much heroin that their breathing slows or even stops. This can lead to hypoxia, which is when the brain stops receiving the proper amount of oxygen. This could lead to death, extreme brain damage, or a coma because brain cells begin to die. If the person lives, but their brain is very damaged, they may need help from others, like a caregiver, forever. Some symptoms of an overdose include slow breathing, low body temperature, blue lips and fingernails, cold skin, and convulsions. The picture on the left is a woman who overdosed in the car, and this picture went viral because her baby son was in the back seat, which just shows that when people are so highly addicted, nothing else really matters to them as much as the drug does. Tolerance in the brain occurs because as the person continues use of the drug, the opioid receptors adapt and the high isn't as high anymore, meaning there's less pleasure. So, the person using the heroin must continuously increase the doses to feel the same high. This creates a dangerous cycle. The two pictures on the left are meant to symbolize how the smaller amount led to the larger amount. Dependence occurs when the brain can no longer function properly because the opioid receptors adapted to the heroin, changing the brain. When the person stops taking the heroin, they can experience unpleasant symptoms of withdrawal, which include restlessness, pain in the muscle and bones, sleep problems, diarrhea and vomiting, cold turkey, which means goosebumps and cold flashes, kicking the habit, which is leg movements that cannot be controlled, cravings for the drug, and mood swings, which often involve excessive crying. Heroin is highly addictive because of the long-term effects of the drug, which produces cravings when the brain creates memories of how pleasurable the drug was, which subconsciously leads heroin users to want the drug again. The heroin disrupts the brain's reward systems when it floods the opioid receptors and affects how the brain functions. The drug-using behavior is reinforced because the limbic system, which is responsible for emotions, is rewired and the activity in that part of the brain changes. Also, some people continue to use heroin to avoid the severe withdrawal symptoms I mentioned earlier, which can last for days. When women use heroin during pregnancy, the fetus can develop neonatal abstinence syndrome, where the heroin goes through the placenta and makes the baby dependent on the drug. Hospitalization and treatment is necessary for the baby, and they must be tapered off the heroin. Some symptoms of this syndrome include excessive crying, fever, irritability, seizures, slow weight gain, tremors, diarrhea, vomiting, and oftentimes death. Babies with this syndrome are usually given high painkillers because it is so painful for them, as you can see in the bottom picture, which is horribly sad. This is a case study about Maren Riggs, who is addicted to heroin. Her parents described her as a normal girl who had a passion for basketball and golf. They lived in a nice suburban area in Ohio. Her parents were unaware of her severe self-esteem problems, which led her to heroin. She became addicted quickly, and her parents started to notice their spoons disappearing as well as their money. They finally found out about her drug use when she crashed her car and subsequently failed her drug test. Maren was placed in rehab and stayed sober for 180 days. After that time period, she relapsed, and her brother and father found her dead just after her 20th birthday. Her mother later found a note she wrote in her journal during her period of sobriety. These are a few excerpts from that letter. Dear Heroin, before I met you, I was full of life, at least from what I thought. But then problems started coming my way, which gave me the excuse to meet you. It was like love at first sight. Not only did you do things for me, but boy, did I do things for you. I lied to my family, friends, and even more importantly, I lied to myself. I would steal and cheat for you. I would risk my freedom and my life for you. But our relationship went to hell when the first and last time you really almost took me away forever. You had me for 7 minutes. I won this battle, and I will never have to suffer again. Sincerely, your worst enemy, Maren Riggs. I found this to be a very powerful note because it shows how strong the drug is and how much it had a grip on her that even after this letter and everything she went through, she still went back to the drug. It is important to note that the heroin not only affected her, but it also affected everyone that loves and cares about her. Thanks for listening, guys.